Bine v-am regăsit, doamnelor, domnilor, aici la Sănătatea Fără Frontiere. V-am obișnuit deja în fiecare săptămână aici, în studioul Observatorul Prahovean, medici de top din Turcia, din cadrul Medical Park Göztepe Hospital. Astăzi vom vorbi despre ceea ce înseamnă transplantul renal. Alături de mine, prin intermediul StreamYard, se află profesorul dr. Soican Barlas. Hello, doctor, can you hear me?
Yes, I can hear you, Luisa. Nice to meet you. Good afternoon.
Nice to meet you. Nice to meet you too, doctor. I prepared some questions for you. As I said, we'll speak today about kidney transplants. And my first question for you is, what are the treatment options for those whose renal failure is in the end stage? Please tell me.
Yes, Luisa. In the end stage of renal failure, I mean, when the kidneys have become fully dysfunctional, the patients will have several options to remove toxic substances from their body and to continue their life. These options are peritoneal dialysis, hemodialysis, and renal transplant, kidney transplant. Otherwise, they may lose their life. For today, kidney transplant is the most valuable option for the patients with renal failure, as it provides both a longer life expectancy and better quality of life. And other options that I meant before are the treatment methods which are used in the patients who don't eligible for kidney transplant and make them save time to continue their life.
I understand, doctor. Please tell me what is exactly kidney transplant?
Shortly, the kidney transplant is the transplantation of the kidney from one person to another. In this procedure, donor may be either cadaveric or living. In the kidney transplant from a cadaveric donor, kidney is transplanted from a brain-dead patient. Okay. It is performed within the framework of each nation's own program and rules specific for this procedure. In the case of a transplant from a living donor, the organ needed by the renal patient is donated by a beloved one or relative of him or her. In this method, the kidneys is verified to be healthy and functional through certain preliminary tests, which makes it possible to perform a much more successful transplantation with lesser complications.
Can the donor, doctor, the living one, of course, can the donor live with only one kidney?
Of course, there are lots of papers, researches about that, and the donor can live with one kidney. Everything started with this previously, nearly 60 years before, when the researchers saw that a person can live only one kidney. Then we had the right to start the kidney transplantation from a donor to a recipient.
Please offer us some more details about transplants from a living donor, doctor. What benefits can you identify?
In the transplants from a living donor, and of course, the kidney to be transplanted undergoes pre-operation health screening and checks. The transplant procedure is performed under the most suitable conditions in a planned operation, not under emergency situations. The kidney removed from the donor is transplanted to the recipient within a very short period of time without being kept on ice for hours. For all these reasons, the transplants from living donors generally have higher rate of success with a longer lasting kidney after the operation. You can see the transplanted kidney functioning immediately after the operation. So the recipient and the donor can stay shorter in the hospital and they have the chance to go back to home earlier as the result is accomplished quickly.
You already answered me, doctor, but I want to ask you to offer us some details. From whom can I receive a kidney if I choose to make this kind of transplant? You said from a dead person or a living one, a relative?
You know, now I'm talking about the living kidney donation. So this the 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 issue is regulated by the laws of the country where the transplant will be performed. That differs from country to country. I mean, that can be different in Turkey or that can be different in Romania. For example, according to the Turkish laws, a candidate kidney transplant recipient may receive kidney from his or her relatives of up to fourth degree.
Okay.
What does fourth degree mean? I mean, the first degree means the recipient's mother, father, children, spouse. The second degree means the recipient's siblings, grandfathers, grandmothers, grandchildren. The third degree means the aunts, uncles, nephews. And the fourth degree means the children of the recipient's uncle or aunt, or in other words, they are cousins. And similarly, his or the recipient's relatives of up to fourth degree, the spouses of the recipient spouses relatives of up to fourth degree may be a donor in a kidney transplant if the candidate is married. But of course, for the purpose of kidney transplant, minimum 2 years must have passed since the date of marriage in order for a couple to be considered as married, according to the Turkish laws, I mean.
And according to the Romanian laws, doctor?
I don't know the Romanian laws exactly. I'm sorry that, but in Turkey, if you don't have any relative, suitable relative, but you have a close friend who is willing to donate, or if you have a partner but you don't have any official certificate of marriage, this kind of recipients may undergo kidney transplant if they are deemed eligible after the evaluation of a central ethics committee. But I don't know the laws or the conditions in Romania. I'm so sorry.
If there are compatibilities, I believe it's the same thing here in Romania. The same rules are applied also in our country. My next question for you, doctor, what are the points to be considered in preparing the donor and recipient in kidney transplant?
The most important issue in the kidney transplant is that the donor is not harmed by this procedure. The donor is the most important person in whole procedure. So through the preoperative test performed, it is made sure that there is no increased risk of developing any disorder of kidney or any other organ for the kidney donor in his future life. For this reason, the donor undergoes very detailed examinations and tests. In other words, every person who looks healthy might not be eligible for donating his or her kidney. And apart from this, another important issue is in kidney transplantation is the blood type compatibility.
Okay.
I mean, if we have a recipient whose blood type is zero, this person can only receive kidney from a person whose blood type is zero.
Okay.
But a recipient whose blood type is A can only receive kidney from a person with a blood type 0 or A.
And so
And
on. B and
yeah,
AB.
but for the group AB, the recipients that have a blood type group AB can receive kidney from the persons having any blood type.
Any
This is
blood type.
important point. And of course, thanks to the advance of the medicines used in the transplantation process over years, the results are quite successful in living kidney transplantation, even without tissue compatibility. So, especially in the early stage of kidney transplantation, tissue compatibility is not necessary.
I understand. Is the option of transplantation off the table if someone who wants to get a kidney transplant has no matching donor with a compatible blood type?
No, of course, there are other options. For couples having no blood type compatibility, there are two alternative options for transplant from a living donor. The first option is transplant with incompatible blood type, and the second option is the cross kidney transplant. The first option, a recipient having incompatible blood type with the person who can donate his or her kidney, that is the only person who can be a donor, is one of the most common problems encountered during the preparations for kidney transplantation. In such a case, we measure the severity of the incompatibility of the blood type between the recipient and donor using some special tests. In those couples whose blood type is incompatible is less severe, it may be possible to perform the kidney transplant with some other special treatments, as in those whose blood types are compatible. Of course, this is a method that can be performed by a much more experienced and equipped transplantation centers. And the other option is the cross-donor kidney transplant. A cross-donor kidney transplant is the matching of a donor and recipient having no blood type compatibility with another couple having no blood type compatibility between them. For example, if we have a recipient having blood type A and the donor having blood type B, and if we have another couple with a recipient blood type B and the donor blood type A, we can perform the two transplants at the same time, and can proceed. Both couples can have kidney transplantation at the same time.
Understand. How long does it take for couples applying for kidney transplant to prepare? And after the transplant, how long do they need to stay to remain in the hospital?
In preparing for kidney transplant, 2 to 3 days are usually enough to assess the donor and recipient in detail. If another disease is found out during the test and examinations, the assessment may extend up to 1 week.
Okay.
What is most important is to make sure that the candidate donor will not be harmed in any way by the transplantation procedure. I'm telling this for the third time, I know, but this is the most important thing. So both donors and recipients are examined by an immunologist, cardiologist, pulmonologist, radiologist, nephrologist, psychiatrist, and gynecologist if the patient is female. So they also undergone laboratory tests. Then all these results are discussed and evaluated in a council meeting in which all these physicians are present.
So I understand that, Doctor, you said, you mentioned that thing 3 times, that the donor is more important than the patient, the life of the donor.
The donor is not a patient. The donor
Yes, I
is a healthy
understand.
person. So is donating his kidney or her kidney, but he or she is a healthy person. So the most issue is to protect them in this whole procedure.
I understand. How does the surgical procedure of kidney transplant work, and which surgical methods are used with the patients who are operated?
When the couples are ready, I mean the couples whose preparation process has completed and who are deemed eligible for transplantation, are hospitalized 1 day prior to the operation, and they are informed about the procedure. As a surgical technique, in many centers across Europe, the kidneys are removed from kidney transplant donors through small incisions under the camera view. And before the operation, the most suitable surgical method is determined for and is shared with the patient. The donors are operated with the laparoscopic method being applied by entering the abdomen, or another option, they can be operated with a retroperitoneoscopic method. That is one of the safest methods for donors without entering the abdominal cavity at all. According to me, I recommend avoiding open surgery if possible. While the donor is being operated on during surgery, the removed organ is attached to the recipient, which is readily waiting in the next room at the same time. And we can observe that the kidney starts working immediately. So the success of living donor kidney transplantation depends on the success of this organization. And after a smooth surgery, the average stay in hospital is 2 to 3 days for kidney transplant donors. And for the recipients, this period is about 5 to 7 days due to the adjustment of drug doses, post-transplant life education, and drug use training.
How does the life of the patient changes after a kidney transplant? Is there anything that should or should not be done by those who are involved in the kidney transplant, both the donor and the patient?
First of all, I must state that life after kidney transplantation requires discipline and attention. For kidney transplant centers, any center without a strong post-transplant follow-up program is doomed to failure. The patients who are transplanted should also know that the major cause of kidney loss after kidney transplant is the losses caused by the patient's lack of care, which represents almost 40%. In fact, the post-kidney transplant period should be divided into two as medical necessities and social life. Kidney transplant recipients should be in contact with the transplant center and their nephrologists. They should have regular blood tests, and they have to be protected from infection, and they have to take care to drink water after the kidney transplantation. So kidney transplantation aims to increase the quality of life patients with kidney failure as well as prolonging the lifespan. It guarantees to be able to travel freely, live without loss of workforce, have no prohibited force shortly to enjoy their life. The first year after transplantation is very important in terms of both possible infections and the compatibility of the kidney with the recipient. I mean, the kidney rejection will develop or not. We usually see that after the first year after kidney transplantation. So the biggest problems usually occur in the first year. However, as I said in the beginning, the secret of a long and happy life after kidney transplant is the patients being disciplined and attentive with a correct post-transplant follow-up program.
I understand you mentioned earlier, doctor, the lack of care from some patients. What can we do to prevent a kidney transplant?
To protect the kidney or to prevent the lack of care, you mean?
To protect our kidneys so that we don't get
faced with the loss
in
of
this
kidney,
situation,
right?
to need a transplant.
Yeah, as I mentioned before, for the centers, we need a serious, strong post-transplant follow-up program. We always call the patients by phone, text them messages, send them emails, and call them to the centers or make them send their labs or results to the centers and make a close interaction with the patient after kidney transplant. And for the recipients, after a couple of years, they feel that everything is going fine and everything will go fine. So that needs care to take care of the kidney. So they have to be sure that they are taking their medicines in time, drinking water, and being aware of risk of infections. That's the key point.
I understand. Thank you very much, doctor, for all this precious informations you offer to our Romanian viewers. Hope to talk to you again.
Thank you so much. It was a pleasure for me. It was a pleasure for me to join your program. Thank you so much.
It was a pleasure for us too. Thank you very much, doctor, again.
Goodbye.
A fost, doamnelor, domnilor, așadar, profesorul dr. Soican Barlas. Am vorbit despre ceea ce înseamnă transplantul renal, când se impune acest transplant, cine poate fi donator în cazul în care pacientul are nevoie de o astfel de intervenție chirurgicală și mai ales care sunt metodele de prevenție pentru a nu ajunge într-o astfel de situație. Vă mulțumesc foarte mult că ne-ați fost alături. Ne revedem data viitoare cu un alt medic de top de acolo din Turcia. Numai bine, la revedere!